This program is supported by San Juan Regional Medical Center, who's expanding its services to offer low-cost blood screenings all year round, now offering walk-in convenience to get the blood tests you want when you want them. MyLabs, patient-ordered testing, is available in Farmington at the hospital's laboratory and the Outpatient Diagnostic Center on 30th Street. Also in Aztec at San Juan Health Partners Family Medicine at 120 Llano Street. With nearly 20 tests available, there's an option for everyone. MyLabs, patient-ordered testing, a wellness service of San Juan Regional Medical Center. (8:37). Wednesday morning on KSJE. You're listening to the Scott Michlin Morning Program. Good morning, everyone, and good morning to our viewers who are watching us today on Facebook and YouTube. Here's a look at the sunrise over San Juan College from earlier this morning. Outside right now, it is 32 degrees in Farmington. Winds are out of the east at 5 miles per hour. And our weather forecast, we are expecting mostly sunny skies for the next several days, but a bit cooler. 57 for a high today and clear in 28 overnight. 51 for a high on Thursday, but a bit windy Thursday night with a low of 19. Sunny and 50 on Friday, mid-50s on Saturday, and again overnight lows in the 20s. I'm Scott Michlin, and my guest this morning on the program from the Basin Health Companies here in Farmington, CEO Vince Moffit is here once again. Good morning. Thanks for being here.
Good morning, Scott. Thanks.
Good to have you along. Also joining us here in the studio is Stacy Chang. She's the Hospice Clinical Director for Basin. Good morning to you.
Good morning.
And thank you both for coming in again to talk about this important topic as we get older. We were talking earlier about how the population is aging. These baby boomers aren't getting any younger, and so we need these health care professionals and programs and things to help us as we get older, because we normally get more health problems as we age.
Yeah, absolutely. And I think and one of the things that we didn't talk about, one of the big things we do is keeping people out of the hospital.
Right.
And I think, if you had a choice to sit in a hospital bed or stay at home, you go and stay at home. Our other services through Basin Coordinated, we provide caregivers. And a lot of our clients that use those services live, hundreds of miles away from a medical facility, from a clinic, from anything.
Sure.
So having somebody there that can help provide care for them, it keeps them out of long-term facilities. And it's a really great benefit to our community. We employ these people, we train them. We make sure that they're doing what they need to be doing and that they're responsible. And actually, I think it's really improved the quality of life of San Juan County and New Mexico through those services. And
so talk to us a little bit about what this means as folks are driving around or will drive out to people's homes to help them with potential health issues or maybe help to get their lifestyle a little healthier so they don't have health issues?
So most of the people that use our services coordinated are Medicaid clients, and they're going to be it's going to be more of a chronic condition. So it's going to be something that they're probably not going to improve in much front, but they can improve the quality of life by having someone there that can help bathe them, help check their their vitals, and take care of the different things, keep their home safe. These are all types of services that these guys would provide, they're regulated as to how many hours that they're actually able to provide. But the whole goal is to keep that person out of a there's not enough beds in San Juan County between our long-term facilities and our hospitals, so to keep them out of those facilities as long as possible and improve their quality of life and their independence, which I think is so under, everybody you see in the movies, you talk to people who've been there, nobody wants to go to a nursing home. They do an excellent job taking care of those people in nursing home, but people don't want to go because they want to be independent. And so we're allowed to provide that. And I think, we're blessed to be able to provide these services, whether it's guiding someone through the end of life, taking care of someone's wounds or teaching them how to use new medications and so they can get out of the facility, get home and start living independent again, dealing with a condition. Maybe they had a hip replacement. Those are things you've got to learn how to change your quality of life, to improve. You need therapy, you need all those things. We can provide those services to them.
I see. And as you mentioned, staying at home and providing services at home also lowers the cost for health care. We always talk about the increasing cost of health care in this country. This is keeping it down.
Yeah, absolutely. I think that's probably, from a taxpayer standpoint, probably one of the biggest benefits. Yes, there is going to be a need for people to be able to have access to health care. We need to find a way to do it more efficiently. And I truly believe that we've got to start looking at home health care more. We still have therapists, we still have clinicians, nurses, PTAs, home health aides, all these different things, that nutritionalists, dietitians, that can help provide a quality of life that the hospital might have.
Right. Very true. Talk to me a little bit about a new nonprofit that the Basin Health Companies are working on, right? This is something then in relation to your hospice
Yeah,
line?
so, one of the things that I really wanted to do is I saw a need in the community, and I think every community has these needs, regardless of the resources available, but to help provide services for our clients who don't have Medicaid, don't have Medicare, that don't have insurance. So a lot of our indigent population. So it's mostly geared towards our hospice. It's the Basin Good Neighbor Fund. We're actually waiting for our tax-exempt status right now, so hopefully we'll have that very soon. But the goal is to be able to provide funds for those who can't afford services or don't have Medicare. And I think that's one of the things that every community is going to have, that kind of need. Unfortunately, someone's got to subsidize it, and I think we do a lot of those services, but there comes a point where we've reached capacity. So this provides us and other resources in the community, not just for our services, but someone else that maybe are going with. If we have funds available, we will use it to support those who are in need of hospice services in San Juan County.
Gotcha. And that seems to be, from a business standpoint, a bit easier to do with a nonprofit than with the other for-profit
Yeah,
company.
sure. I think we've drawn some really distinct lines. We've created a board of directors for some accountability, real distinct lines between our nonprofit and our for-profit business. And really our goal is to increase service to the community. And I think, as long as we can keep that very clear and consistent, I think we're going to be successful there. It's going to be a good benefit for the community.
Sure. You already know there's a need, so...
Yeah, sure. And I think, PMS had a nonprofit hospice for years in this community, and unfortunately they had to close last year. And that really, even with their services, I think there's still a need, but I think even more so now, because there's an unmet population out there that have financial restrictions, but they're still needing these services.
Right. Stacy Chang, let me ask you real quick here as we come to the close of the program, just a few minutes remaining, but when we're talking about hospice, what are some of the things that folks should be aware of for hospice if they have someone in their family? How soon can they get on a hospice program if there's a diagnosis of a terminal illness? Is it 6 months? Is it a shorter period? You mentioned earlier how if you can get that patient sooner, you can really help with controlling their quality of life and their pain management and things along that line, right?
Sure. So it's somewhat dependent upon diagnosis.
I suppose that's true.
So
right.
Obviously, first of all, patients need to no longer desire treatment, especially if they have some sort of oncology diagnosis.
Right.
The second thing is, unfortunately, with years of abuse of the Medicare hospice benefit, they've become pretty selective in how strict we need to be. So dementia is a qualifying diagnosis, but the patient has to be at a certain level because patients can stay demented for a very long time. So there are certain criteria that we need to meet. I've had patients on for 2 hours. I've had patients on for a year. So essentially, as long as a physician certifies within their best estimate that a patient has 6 months or less to live, we can keep them on service. And those benefits on Medicare don't go away. They continue. So as long as I am able to show decline, even if it's as simple as the patient is eating less, I can leave them on hospice. Certainly we do have patients that graduate. They don't meet that criteria.
Right.
And that's always a good day when we need to remove people. And then the final piece of that...
Let me stop here just for a minute and ask you about that. When they graduate from hospice, that means they no longer need those services. They have improved enough that they're not dying necessarily.
Correct. Or they've kind of plateaued.
Right.
And so before, when I mentioned that Part A and Part B of Medicare, for lack of a better word, are deactivated, that can be reactivated. The biggest struggle that we have with that, and I learned this the hard way, so we very much make very very clear to providers if patients are kind of on the edge and we think they might be there, but they're not, that they're willing to take that patient back. Because the problem is when they come to us and they're no longer seeing their primary care doc, we've kind of taken them out of the system. So we want to make sure that we have a way to get them back in the system. Patients can choose to go off hospice if they decide, oh, I want IV fluids, I need to go back into the hospital. But then generally we don't put them back on. I mean, we really need to make sure that people are comfortable with being at home and letting nature take its course. So it's really just a different way to provide care, and it's just a different mindset that people need to
Sure.
work their way to.
But it is, I guess, an option for families
Yep.
and for people in our community that they should make themselves aware of what is out there. And,
Yes.
and again, it's a case-by-case basis. I know you can't make a blanket statement.
Right, it is, but I really, I wish people would call and really truly get the facts, because there are a lot of misconceptions about what hospice is. And I think for our people, especially people that we have had for a while, I think they would all tell you that we made a tremendous difference for their loved one. And don't get me wrong, it's hard work. When patients go on hospice, the family has to take care of them. We provide education, we provide medication management. We're all OMI certified, so we give families the ability that we pronounce at home, so we don't have to call in the authorities, things like that. But it's hard work because the family's taking care of the patient. And so you have to have the right family that's able to make that commitment and do it as well.
Sure. But you understand, and your staff has been trained too, that that's a very emotional time for these families,
Yes.
and so you can help them maybe process some of those raw emotions to really try to help their loved one be at home and be comfortable.
We hope so. I mean, that is obviously always the goal.
Right.
So.
And I add to that, if what you just said, Scott, I think what Stacy and these guys do is they deal with this on a regular basis.
Right.
So they're prepared. Doesn't mean that something new is not going to come up. They're going to be like, oh, I learned from that experience. But when you're dealing with people that are trained to do that, and you're dealing with a team of them, the pharmacist, the nutritionist, dietitian, the doctor, the nurse practitioner, the clinicians, all of them working as a team to guide that. If you do not choose a hospice benefit, you don't have that. And that's, I think, the thing is you've got a team now to support you. Yes, you're taking care of them at home on your own, but you got support to do it. And one last thing is, with the hospice, is there are other hospices in town. I want to be very clear that I just want people to use a hospice benefit. I think
Right.
it's such an underutilized thing, and we've seen so much benefit from it. Please consider using hospice, even if you don't choose Basin. We hope you do. And we work really close with the other home health care companies in town. There's a few different Southwest, Guardian. They're all great. We hope you choose us, but if you don't, consider home health care. And I think that, we at Basin are involved in grants and Gallup. We have offices there as well. We're committed to the community. We're very involved through philanthropy and different efforts for volunteerism and stuff in our community, starting the nonprofit. And we want people to feel comfortable with us and realizing that we're going to guide you through this process. We're either going to help you heal, we're going to help you find independence, or we're going to help walk you to your end of life. But whatever it is, we want to do it with excellence and service-minded.
Good point. And I also want to point out you've got an event coming up with the Farmington Chamber of Commerce, right, on November 27th, the Lunch and Learn, and folks can learn more about some of the things for our aging population and what's available.
Sure, and my nurse practitioner is going to join me for that. So we'll be there, and we'll be talking about benefits of hospice and home health.
Okay, this is a free event.
Free event.
For folks to come and bring your own lunch and
bring lunch.
And go to the chamber, but they want an RSVP, so they just have enough chairs, I think, for everybody to...
Sure, absolutely. It's hopefully it's going to be a very fun and educational time.
Very good. It is Tuesday, November 27th for our radio listeners, noon to 1 p.m. at the Farmington Chamber of Commerce in downtown Farmington. Again, a free event. You can RSVP with the Chamber at 505-325-0279. Again, my guest from the Basin Health Companies, Vince Moffit, thank you for being here.
Thanks for having us, Scott. It's always great to be here.
Glad for you to come. Thanks so much. And Stacy Chang, thank you for being here.
Thanks for having us.
Have a good rest of your day, both of you, and we'll talk to you again soon, I'm sure.
Thanks, Scott.
All right. Thank you both very much. My guests here on KSJE, and I'll be back with more in just a moment. Our visit to the Encouragement Lab is coming up next on KSJE. The time right now is 8:51. This program on KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative, and caring team of professionals to serve wealth management, trust administration, employee benefit plans, retirement planning, and estate settlement needs. Find out more about Citizens Trust and Investment Corporation at 505-599-0181.